Okay, so I would like to welcome everyone to this webinar, the UHC Compass and Social Participation, Empowering Patient Organizations to Hold Governments Accountable for Universal Health Coverage. But before we begin, I just want to go over a few housekeeping details. Next slide, please. We are pleased to offer simultaneous interpretation into Spanish today. To join the Spanish channel, you just click on the globe icon, the bottom menu of Zoom. And if you experience any difficulties with this, please don't hesitate to ask for our help. You can reach out to us on the chat, and the IAPO team here will assist you. We would love to get to know you, know who you are, and please take a moment to introduce yourself in the chat here. And also feel free to post any questions you have, and we'll address as many as possible today. Next slide, please. So my name is Dani Motzi. I'm the CEO at IAPO, and I'll be moderating this session today. IAPO is the International Alliance of Patients Organizations, and we are an alliance representing almost 300 patient organizations across all disease areas from all regions of the world. We mobilize and support patient organizations, empowering them to play an active role in decision-making processes, shaping the global health landscape. And 25 years ago, we came together to work on shared goals for the patient organization community and goals that go beyond national borders. In these 25 past years, one key agenda for IAPO has been universal health coverage. And on the eve of UHC Day happening tomorrow, we are celebrating a fundamental milestone in IAPO's journey advocating for UHC. Today, we're launching the UHC Compass. The Compass is a very innovative tool designed to empower and support patient organizations on the ground and helping them drive progress toward universal health coverage within their own countries. This tool was created by the Global Patient Think Tank, which is a group of a very diverse group of patient representatives from all over the world that was convened by Roche to ensure that the patient voice is central in UHC discussions. IAPO is proudly hosting the UHC Compass on our website on behalf of the Global Patient Think Tank. And Nicola Bedlington, Smita Sadasivan, and Paul Mendoza will very soon share more details about the Compass and how you can use it. But first, let's set the stage and explore the context in which the Compass is being launched today. I truly believe that we are at a pivotal moment in global health, one that has the potential to drive real change at the health system level and cascade meaningful improvements to local communities. Very recent coordinated efforts are reshaping the global health landscape and creating opportunities for impactful change on the ground. And I'm referring here to the work of initiatives like the UHC 2030 movement and CISEM, the Civil Society Engagement Mechanism for UHC 2030. But also, I'm referring to the groundbreaking resolution on social participation that was adopted early this year at the World Health Assembly. Pamela Cipriano and Domizo Gasha will share how the UHC 2030 movement and CISEM are raising awareness, building collaborations, generating knowledge, and advocating to hold governments accountable. And that's exactly the focus of this year's UHC Day campaign, which is led by UHC 2030. And Dr. Vesna Patrick, she will speak about the vital role of governments and how they can ensure UHC becomes a reality, but also the importance of social participation in all of this. The resolution on social participation, on the other hand, in addition to this global coordinated efforts that I just mentioned, was created to ensure that the voices of patients, people with lived experiences, and communities and civil society are meaningfully engaged in health policies and services. Social participation is essential for building strong health systems that achieve universal health coverage. And to delve deeper into this topic, we also have Lara Bradley with us. So throughout this session, we will explore all of this, but also how the UHC Compass can be a very powerful tool for holding governments accountable and accelerating progress towards universal health coverage. Thank you so much for joining us today as we embark on this important conversation. And now I would like to invite Dr. Pamela Cipriano. She's the co-chair of UHC 2030, but also the president of the International Council of Nurses. And she will talk today about the UHC 2030 movement. Over to you, Pam.
Thank you, Dani. It is really my pleasure to be invited to participate with IAPO in this webinar this morning. And I congratulate IAPO and the think tank on the launch of the Compass, which will be an incredible tool for universal health coverage. And as Dani mentioned, tomorrow is Universal Health Coverage Day, the 12th of December. And with the passing of the WHA 77 resolution on social participation, health, and well-being this past May, we know it is the key moment to advocate for implementation of this resolution. So we want to be sure that today we focus on elevating the united voices that include our patient voices and really focus on social participation and the emphasis that you can place on financial protection. If you could go to the next slide, please. We know that social participation is critical to being addressed the severe lack of coverage of essential health services, but also the fact that nearly 2 billion people are experiencing financial hardship. And these are not just numbers. As you know, this is people making choices, struggling every day between determining if they can pay for health services or whether they can pay for the essential aspects of health, well-being, food, clothing, shelter. So it's really critical that we are building equitable and resilient health systems that place people at the center of these policy decisions. As we know, well, I've said we have seen more coverage, but at the same time, we've seen more people being pushed toward or further into poverty, which is why we believe it's so important this year to raise the alarm and the emphasis on financial protection. We only have about another 5 to 6 years to get back on track for achieving UHC. So we want to be able to make sure that this is a very powerful message this year. On the next slide, I want to share with you a little bit more about UHC 2030, in case you're not familiar with some of our work. But we're the global movement to build stronger health systems for UHC. We have a global platform that's based on a shared vision to empower stakeholders to take more action. And one of the defining features of our platform is strong engagement from civil society. And the civil society engagement mechanism, CSEM, is really our civil society arm. They are critical. You are critical to the UHC movement in terms of really bringing that lived experience and being able to share the realities of individuals that continue to underscore why the basic principles of UHC of coverage when and where individuals need it, that it's of high quality, and there is financial protection so that people are not pushed into poverty. So our mission continues to focus on building equitable and resilient health systems that leave no one behind and provide the foundation for health security. Next slide, please. I want to tell you just a little bit about our structure. Actually, if you can go back one slide. Okay, so I mentioned we're a global multi-stakeholder platform. We have many, many members, countries, civil society, private sector, parliamentarians, which is really critical as we bring together these voices, as are all of the civil society voices. The UHC 2030 government structure starts with our secretariat from the World Health Organization, the OECD, Organization for Economic Cooperation and Development, and the World Bank. We also have a political panel and a large steering committee that I'm honored to co-chair with Dr. Magda Rabala, president and co-founder of the Institute for Global Health and Development from Guinea-Bissau. But essentially, again, really focusing on the fact that we have to bring together multiple voices in order to mobilize this multi-stakeholder platform. Next slide. We're very excited this year. We have a strategic framework to guide our work for the next 3 years. And there are 3 pillars of this work, which you see on the slide. Advocacy, which focuses on influencing decisions within the political, economic, and social institutions that we work with to advance UHC. Accountability, one of the key areas across any major action that's taken. So we're tracking the implementation of commitments so that we know whether actions are actually translating into decisions and policies. And alignment, convening stakeholders to discuss and elevate the importance of these issues. Just briefly, the UHC 2030 Steering Committee, which sets our overall directions and approved the strategic framework, includes more than a dozen countries, CSOs, foundations, representatives from the private sector, multilateral organizations, and of course, our secretariat. Next slide. Hopefully you have seen this slogan, this logo, health, it's on the government. This is the theme for UHC Day 2024, which hopefully you've seen some casting already of cards and messages on social media. We think it's really important that these issues come forward, especially financial protection this year. And you'll be hearing from an excellent member of a parliament that can again bring to reality what we know is true about making sure that we're focusing on UHC and the role of government to strengthen the work in that area. Next slide. And how do we do some of that? We have to rely on resources that will allow all of us to become active in terms of taking the information that we have and being bold in everything from writing to your parliamentarians, to your decision makers, to make sure they know your position in terms of advocating for UHC. There are tools that you can find that have been developed by UHC 2030 and CSEM that are on our website. We have a toolkit. Please, use your connections for social media and all of the work that you do to make sure that you are amplifying the voice of your organizations and patients, because we know that this is again, that bringing that lived experience to life. The patients are directly affected by the financial barriers and financial hardship. There is nothing more powerful than understanding that lived experience. On the next slide, you'll see, again, there are a number of opportunities to really mobilize in 2025. And these are some of the major meetings, both at the global, but also national level, that can be extremely powerful. So the World Health Assembly is coming up, as well as a UN high-level meeting on NCDs. These are excellent opportunities for all of us to be able to advocate for UHC. We want to translate the political commitments that have been made into action. That means laws, budgets, policies, and programs. And our targets are the heads of state governments, ministries of finance, parliamentarians, and local governments. We're asking them to prioritize investment in primary health care, as well as the health workforce, and be able to reduce the financial barriers, particularly affecting marginalized populations. In addition, there's inclusion of UHC and financial protection in the SDG voluntary national review that'll be occurring this coming year in 30 countries. We know national elections can make a difference. We encourage you to talk to candidates and vote for those that you know have the interest of health and well-being at heart. And then also UHC 2030 will be doing some planned country consultations. Last but not least, in the last slide, we encourage you to stay informed, be involved. make sure that you are doing all you can to keep your parliamentarians in the know, as well as letting them know that you expect accountability. This is a really critical time, and it's important for all of us to remind everyone of the benefits of financial protection, because we know when people are healthy, they are strong, productive members of society, which boosts everyone and boosts the economies of our country. Thank you.
Thank you, Pam, and thank you so much for highlighting the role of different stakeholders in all of this, and highlighting especially our role as civil society in these discussions and how much we should be engaged in this. To talk about the government perspective, I would like to invite Dr. Vesna Petrick, sorry, head of the Office for Cooperation with the World Health Organization, and she's from the Ministry of Health of Slovenia. She's also going to bring us her expertise and experience in this resolution on social participation. Over to you, Vesna.
Thank you very much. First, thank you very much for inviting me to this important event. Be patient with me today because I'm sitting here in an institution, European Observatory of Health Systems and Policies. I'm in a board, but these people today are celebrating. It's December time, and it might happen that you will hear a lot of noise behind my back. But to me, this event is really important. So I'm going to spend some time here with you to share with you what actually governments meant when they pushed for social participation. It has so much to do with UHC. And you, as it was already said, all know that last year we were so disappointed that progress is not as we expected with UHC. And we were thinking, you know, what actually were the reasons and how we could proceed better. But Slovenia, a little country in Europe, we believe that we have some solutions, and it is because we have so good experiences with not NGOs helping us in improving access to health services, getting vulnerable population to the services, which are indeed available in my country, and we definitely are not country that are people are suffering with financial hardship here, but this doesn't mean that people get what they should anyway, because they often don't access services in time, even though they are there for them. And it has to do with so many things, but most of the time it has to do with vulnerabilities. So in Slovenia, but also when I was in the EB, the chair, and discussing with other EB members, and it is about WHO, as you know, we were quite clear about the WHO and governments investing in UHC is actually governments and WHO investing also in civil society. So we started to speak about, you know, how we could better work together. And I was very ambitious myself, but I was surprised how other countries also were supportive to this idea that we should start considering those NGOs that actually contribute to health systems in what they do as part of the health system. Not something that is, you know, just there to make us accountable, the governments, you know, but also working with us, helping us to proceed better and in what we are after and what we have actually assigned for when we have all these discussions at the decision-making bodies of WHO. And there are many other reasons I would want to share with you why it's so important that governments invest in civil society that works in health area more. Yes, definitely is about advocacy. You are very important people when it comes to advocating for health in governments where we have to compete with other factors, you know, and the finance ministries are not always understanding how important it is to invest in health sector. But you are also the ones who work with people and understand the needs of the most vulnerable, young people, patients, elderly, sometimes much better than even the professionals do. And not only this, you can also help us address the needs better. For example, how are we going to deal with health literacy, the governments, health professionals? Health professionals are already overburdened with so many tasks. How are they going to ensure that those most vulnerable, or for example, men, middle-aged men that don't really go to doctors so much, would understand that it's so important for them to do the checkups and to do the screenings? In my country, we have realized that we cannot do it without NGOs, and we have asked firefighters, the hunters, to help us with men and to ensure that they understand how manly it is to go to the colon cancer screening. And we really improved our numbers dramatically. So this does work, but it needs investments. And when I'm speaking of investments, what do I mean? Government investing in civil society. It's not only about financing, but financing is important. In my country, we do finance NGOs through tenders, but there needs to be some sustainability. They do need to have some core financing and employments even, and they need to be secure so that the investments, for example, in trainings pay off. Because we make these organizations stable, and investing in trainings is also something that professionals can help us. But it's also sometimes that we need to legislate how we work with NGOs. For example, in my country again, and I use examples from my country because it's good to understand what I'm speaking of, not just using big words, but not really other people understanding what I'm after. We have legislated mystery shopping, so youth organizations are helping us to understand better if the legislation on tobacco control and alcohol policy is respected. And mystery shopping, I don't know how much you know, is inspectors going with young people and checking if it works in practice. And it doesn't, I can tell you. Inspectors will tell you it does, 17% only it doesn't. But young people will tell you 95% it doesn't. So we have legislated this. And for example, it's not only about legislating, financing, and working together, but it's also a recognition that needs to be given to the work done by the NGOs. All the reports on health sector needs to include what the civil society is doing. Not just what the government is doing, but also the impact civil society has on health with what they are doing. For this, of course, we would need to invest in evaluation, but evaluation needs to be fair. That, I hope, it's quite clear also. So when I say all of this, I would try to conclude by saying that what we are after with the resolution on social participation is WHO and the governments invest more in civil society, but also involve them more in decision-making and in implementing our policies. So you should be there, considered as part of the system. And I don't think I'm going too far by saying that we want to institutionalize social participation. That would mean that it's everything I said before: financing, inclusion in decision-making, legislation that supports this, and also recognition and evaluation. All of this means institutionalizing social participation. There are many countries that think similarly, and we have just a week ago created a network of those countries that really want to work in this area and invest more in social participation. And basically, it's all about trust. Not just government and civil society organizations, but also government, civil society organizations, and professionals. Professionals sometimes don't trust civil society because they say they don't work evidence-based. But I always say, why don't you invest in civil society so that they will know what is evidence-based? Why don't you work with them to ensure that everything they do is evidence-based? And most of the time, my experience is this is exactly how it is. It is evidence-based. They do the evidence-based work. Now, I know Lara is going to say more about the WHO and how they are going to help the countries to proceed in social participation. I just want to share with you that we are very ambitious, those countries that are in the core group, and we want to bring this to UNGA next year. So I hope we will have all your support as we had it during the process of adopting the resolution, because without you, we wouldn't be as successful. And as you remember, this was one of those resolutions that really had a consensus when we were adopting it. And that made us people really happy, because we understood that there is some agreement that we have to work together if we want to proceed. Thank you so much.
Thank you, Vesna. Wow, I wasn't aware of the plan for UNGA, so I'm very excited. And let's make a commitment here, not only IAPO, but everyone here, for us to support this to happen. I would now pass the floor to Lara Burley. I hope I'm pronouncing your surname correctly. Special Program on Primary Health Care, Universal Health Coverage, Life Course. She works for the World Health Organization, and she's from the brilliant team who created this resolution in partnership with those member states that Vesna was referring. Over to you, Lara.
Thanks so much, Danny, and thank you, Vesna and Pam, for building the momentum on this and giving so much rich background and context. And the ambition of the resolution, Vesna, I think we can feel it. It's palpable even through Zoom. So I'm just going to briefly talk about the resolution, which was led by the member states. We just provide back support. But it was very exciting. And I must say, as Vesna said, to have this resolution adopted unanimously in May at the 77th World Health Assembly by 194 member states and co-sponsored by about 27, was the product of a very committed group of countries. And so Vesna was driving this with Thailand, Slovenia and Thailand, along with Brazil, France, Norway, and Tunisia. Next slide, please. Before I go into too much detail of the resolution itself, just to make sure we're all clear about how we've interpreted social participation, and both Pam and Vesna and Danny have talked about this already, so hopefully it's just reiterative. But social participation is defined in the resolution as empowering people and communities through inclusive participation in decision-making processes that affect health across the policy cycle and at all levels of the system. And here we're talking about really power, empowering people, communities, and civil society in health system governance through equitable, diverse, and inclusive participation. The objective is to amplify people's voices, and especially those who are in situations that are marginalized and vulnerable, and to make policies and programs more responsive to their needs. It calls for a shift in the modus operandi of governance, whereby governments respect, value, and regularly engage these groups and their lived experience, their needs, their preferences, to co-create health systems. So it really is about power sharing and a joint vision and a joint effort to improve people's health. As mentioned, it should happen at all levels. So really, we're not talking about something that's a top-down or national process. It's really something that you would hope to see at all levels of the health system and throughout the entire policy cycle. So as Vesna very clearly said, from not just in decision-making as such, but from situation analysis, priority setting, planning, budgeting, to implementation, monitoring, and evaluation. And this is really, the member states that drafted the resolution really emphasized that this is about health. It's not just about health services, and it's about all social determinants that inform health. So we are taking a broad view because we're aware that people's health is determined both by the health sector and by beyond the health sector, and participatory processes to inform those drivers of health are equally important. The next slide, please. I think we've heard a lot already. Sorry, you've gone two, so one back, please. We've heard a lot already about why social participation is important, so I won't spend much time on this slide, but it's important for many reasons. It's not just important because it's morally the right thing to do and it helps to advance and realize the human rights to health and participation, but also because it's a core driver of more equitable health outcomes and fosters trust and health system resilience, and it can improve health system accountability. It's at the core of primary healthcare, and it's necessary really for more equitable progress towards UHC health and well-being. The next slide, please. So I'll focus in here on what the resolution calls for. I'll send into the chat some links that includes a link to the resolution after I stop speaking, where you can read it in more depth. But the resolution has two sets of operational paragraphs. So it recommends actions for member states, and then it recommends calls on the WHO to support member states by doing certain functions. So for member states, it emphasizes the importance of strengthening capacities, and that's both among public sector workers and among civil society and communities. It makes an emphasis on the importance of equitable, diverse, and inclusive representation. It talks about the importance of it being impactful. So participation is not for the sake of participation alone, but it needs to really influence decisions that are made and policy uptake of the recommendations in participatory processes. It shouldn't be ad hoc, so really about regular and sustained mainstreamed participatory governance and a mix of mechanisms. It's not a one-size-fits-all approach. Every country will have its own context-specific derived versions of participatory mechanisms, but we also find that in countries that have a variety of ways of engaging populations, we get the richest and most varied voices heard. Legislative frameworks can be catalytic and help to sustain participatory approaches over time. And it's important, of course, to have sufficient and reliable funding to facilitate participation. Monitoring and evaluation of social participation is no doubt important because it's important to check not only whether it's happening, but how well it's happening, the quality of participation, and the impact it's happening. So M&E and research should be something that is built into health systems more broadly, but of course also looking at social participation. The next slide, please. The second set of operational paragraphs focus on, sorry, it's skipped two again. Yeah, there we go. Focus on WHO and what member states are asking WHO to do to support them in achieving this ambition. So here we have various areas of work: advocacy to keep the political momentum on social participation and secure political will to take it seriously and implement this agenda. Developing technical guidance and operational tools with a specific reference to monitoring and evaluation, because we know that at present indicators to track both the implementation and the impact of social participation remain fairly weak in most contexts. To document and share country experiences, essentially to convene a platform to facilitate this exchange among stakeholders, to improve the coherence within WHO. So as mentioned, social participation should be happening in all areas of health affecting programs, policy, decision-making, and so on, and implementation. And so it's a horizontal agenda that really is relevant to almost all parts of WHO. So what we find is that it's not something that's centralized within WHO at all. It's mainstreamed across WHO, and we are trying to improve how we work across the organization to have coherence in when it comes to what others outside of the organization, particularly member states, civil society, and others, understand of what we are doing in our work. And finally, to report on progress to the World Health Assembly every 2 years until 2030. So in order to implement these operational paragraphs, as Vesna indicated, there's been this core group of member states that have been joined by civil society representatives, and they met recently to agree on what they would like to see, their vision for a multi-stakeholder network. Please, the next slide, if possible. So this is a picture of some of the core group representatives who met a couple of weeks ago in Bangkok at the invitation of the Thais. And they really worked to discuss the terms of reference for this network. So it's essentially a network to facilitate multi-stakeholder exchange and collaboration. This is the missions or draft mission statement that you'll see on the screen. But it's really emphasizing the importance of collaboration between civil society and member states, along with other not-for-profit partners with a common interest in implementing the resolution. The last slide, please. And just to summarize the objectives that this network anticipates to have. So it really would like to facilitate evidence-informed learning, experience and knowledge exchange across countries and stakeholders, particularly civil society, communities and population groups, including patient advocates. It will facilitate joint advocacy to maintain the political commitment at various levels. It will help to facilitate collaboration and consultation to inform the development of technical products and tools, drawing from the range of expertise and experience among the range of stakeholders that are part of the network and beyond. And it will, of course, contribute to WHO reporting on the implementation of the resolution. So there are now various internal approval processes underway with the hope that the network will be able to be launched early next year, aiming around April, May, so in time for the World Health Assembly. And thank you very much. I'll pause there.
Thank you, Lara. And we'll make sure that we'll communicate any news on the network to the patient community and see how much they can support it. So to finalize this first part of our event, I'm going to call Damiso Gacha. She's the founder of Success Capital NGO, but also she's an advisory member of CISEM, and she's going to talk about why it's so important for the civil society and patient organizations to have a seat at the table when we are discussing about UHC. Over to you, Dami.
Thanks, Danny. I hope my internet will be stable enough. But I think, in terms of the fundamentals to ensure patient organizations and civil society as a whole have a seat at the table, firstly, it's acknowledging that the right to participate in political and public affairs is enshrined in Article 21 of the UDHR, Universal Declaration of Human Rights, Article 25 of the International Covenant on Civil and Political Rights, and Article 12 of the Covenant of Economic and Social Rights. And so for us, meaningful participation empowers individuals and communities to trust and health systems resilience and accountability in those very health systems. One key important element is around ensuring equity in these health systems. And so how can we ensure that meaningful engagement of communities and civil society, including patient organizations, in the governance of a health system is not just essential, but critical for the health system to be responsive to the needs and aspirations of communities on the ground and accountable to those people. And I think, as Pamela alluded, elections, noting our own country, where a historic election led to an opposition party winning for the first time in 58 years of independence, and now having a renewed commitment towards national health insurance and universal health coverage, which is quite unprecedented. Civil society organizations, or formal and informal networks, reflect the lived experiences of end users of health systems. And we are often best placed to understand and include communities who are vulnerable and often overlooked. When the views of civil society and communities are integrated into health system planning, it can help improve the quality of health and outcomes of all. So ensuring that a young queer migrant individual in a rural location can be centered in the context of policymaking can surely ensure that everyone else is included. Vesna spoke about a mystery shopping model, which is quite similar to our own community-led monitoring efforts. And I think just appreciating the fact that that can be legislated is something for us to take on board and advocate. And I think, another, key element is recognizing that civil society, like patient organizations, also play a key role in strengthening accountability. And so civil society can help in accelerating implementation, tracking progress, and holding governments accountable when they don't deliver. This is why, following the 2019 high-level meeting on UHC, the CSEM launched country consultations with civil society and communities to hear their stories and experiences with accessing care as part of the State of UHC Commitment, and essentially a multi-stakeholder review published by UHC 2030. We have conducted consultations with civil society and communities in more than 38 countries, and we have learned a lot from them. For example, learning that despite countries having made progress in initializing UHC, vulnerable individuals and groups continue to face barriers to access the health services and commodities they need. People living in poverty continue to face financial hardship to access care, particularly as a result of out-of-pocket spending. This is a major problem globally, impacting 2.5 billion people. Only an accountable and participatory governance mechanism can ensure that all voices are heard and no one is left behind in the progress towards UHC. As Laura alluded in her presentation, this is one avenue that can reflect a shift in power to civil society and the communities that they serve or represent. The last main point is around building confidence in health systems, particularly where communities cannot trust those health systems or where systemic stigma and discrimination or state-sponsored violence might be issues. A recent study by The Lancet published last year looked into population confidence in health systems in 15 countries. And they found that people who felt that the government considers their opinion when making decisions about the health system had more confidence in their health systems than those who did not feel that way. Also, having learned from the COVID-19 pandemic, we learned so many different lessons, including illuminating what happens when governments make decisions about the health systems without consulting civil society and the most impacted communities like patient organizations. It exacerbates the erosion of trust in public institutions and governance structures, along with aggravating health inequalities. This underscores the importance of ensuring that patient organizations and civil society have a seat at the table in decision-making for UHC and health systems as a whole, particularly recognizing the indivisibility and universality of human rights standards and ensuring that no one is left behind in ensuring health outcomes. Thank you very much.
Thank you, Dami, and thank you for this powerful speech. And I will now rush for the second moment of our session today because we are running a little bit out. We are a little bit behind our schedule, and I want to make sure we have enough time for questions after this second part. So I'm very honored to call Nicola Bedlington. She's the chair of the Global Patient Think Tank that I mentioned that co-created the UHC Compass. And she's also the founding partner of Billwater Partners and a former secretary of the European Patients Forum. She will talk about the UHC Compass and how it was created and so on. Over to you, Nicola.
Thank you so much, Danny, for that very kind introduction. I'm really honoured to be here on behalf of the Global Patient Think Tank. It was very much a collective effort. We'll talk about the think tank a little bit later. Smitha will outline what it's all about. But let's just move to the next slide because of timing. We've covered this, I think, essentially, setting it in context once again. The global momentum on UHC is growing with the need for a multi-stakeholder, whole-of-society approach, recognised, of course, last year in UNGA's meeting. The UHC definition and UHC is anchored in the Sustainable Development Goals, as we know, but also health as a fundamental human right. And I think that should be central to everything that we're thinking about and we're discussing. Patient communities are increasingly seen as critical stakeholders in advancing UHC, complementing, of course, the efforts of wider civil society because of patients' unique expertise and experiential knowledge through living with a condition. Let's go to the next slide, please. Despite recent achievements, a gap remains to enable local communities to really advance UHC. And the UHC Compass aims to address this, to reduce the complexity of UHC and really shine a light on how communities can really make a difference to UHC policies, but also implementation. The Compass helps to identify where patient communities can really get started on their UHC journey or continuing it with more intensity and more impact. And it also looks at how to build the required capabilities by bringing specific, relatable examples, case studies of patient advocacy in UHC from across the world. But it's important to remember that the UHC, if you go to the next slide, the UHC Compass has not evolved in a vacuum or in isolation. An important backdrop to this work, as we've heard today, is the World Health Assembly Resolution on Social Participation, but also the Global Patient Movement Catalyst, which is really homing in on the greater involvement of patients in the political architecture around health, building capability and capacity so they can really work at eye level with policymakers and other stakeholders, but also crucially ensuring patient organisations really have appropriate resources to do their vital work, like all other movements, like the environmental movement, like, for instance, the women's movement as well. So the UHC Compass, essentially, and if we go to the next slide, is a one-stop shop. It really helps people, patients, to navigate UHC, and it's organised essentially in 4 key modules that can also be used as standalone modules, depending on patient organisations' individual needs. And in very brief terms, Module 1 is exploring the case for UHC, enhancing understanding, and really making sure that there's a level of literacy around UHC. Module 2 enables patient organisations to really understand the UHC context in their own country, in their own setting, but also understand what potentially their key role could be contributing to UHC and looking at the coincidence of priorities with what they're already doing, which is really key as well. Patient organisations are often under tremendous pressure, so that's an important piece too. Module 3 allows patient organisations to really assess their strengths and opportunities in advancing UHC, but also perhaps how to fill gaps and how to build capacity and confidence in this space. And Module 4 provides comprehensive guidance, resources, information, best practice to really empower patient organisations in their work, but not only empower them, to really inspire them as well. So if we go to the next slide, the draft UHC Compass was pressure tested by 14 patient organisations across the globe in different geographic areas, obviously, but also different disease areas, thanks to IAPO and other leaders like Anna from the Czech Republic. And we wanted to really make sure it was fit for purpose in real world settings for patient organisations. And as you can see from these quotes, we got very, very good feedback and very concrete suggestions which helped us to really improve and nuance the next iteration of the UHC Compass. We're also immensely grateful to other UHC stakeholders, many of whom are around the table today, who've shared really valuable input. CSEM, UHC 2030, the Unite Parliamentary Network, which had a great meeting in Berlin at their summit where we were able to address a parliamentary inquiry about UHC Compass and how it could be implemented and how parliamentarians could actually work with that as well. And the Global Health Policy Lab, also based in Berlin. So this was a really important process in actually arriving at a tool, a resource that makes sense for people on the ground. If we go to the next slide, I'm delighted to say that the UHC Compass is hosted by IAPO, which is fantastic for many, many different reasons. We know it will be disseminated and socialized widely across obviously IAPO's very vibrant membership across the globe, but also it's got a really strong and trusted network that will also access the Compass and really make sure it delivers. So I know that Smitha will talk a little bit about the GPTT, but before that, Danny, I think you wanted to share with participants how to actually access the Compass, to be able to use it, but also to really engage and get involved. So back to you. Thank you.
Thank you, Nicola, and thank you for sharing the GPTT, bringing this group together and developing this tool with all the team behind you. This is an amazing, amazing accomplishment. I have already mentioned this to you and the GPTT that I'm very, very honored, and I'm taking this responsibility to host the Compass with a lot of pride and responsibility, and I promise everyone that we'll take this forward and beyond. So I would like to invite everyone now to scan this QR code or also to use the link that it's going to be posted on the chat So you can access the landing page of the UHC Compass, and there you can download the tool. As a host of the Compass, IAPO's mission is to disseminate this as much as possible within our global patient community, but also beyond to other stakeholders, but also to keep enhancing this tool. We keep saying that this is a living tool that we will improve with new content, new topics related to UHC, but also case studies, and how the use of this tool can be improved as well. And on that front, I'm very thrilled to let you know that we are going to digitalize the UHC Compass in 2025. And because right now it's a PDF, an interactive PDF, but we are looking into making it a digital tool. Next slide, please. So what you as a patient organization, a patient advocate can do with the Compass. As I said, let's start using it and put it in practice, but also don't use it only once. Keep using it, keep coming back to the tool, keep refreshing your knowledge, refreshing the way you use it to see how much you are advancing with your agenda on UHC. Also, share with us whatever you want you're doing, any case studies that you came across or you already have to share with us, any topics, any difficulties or successes as well. We want to learn from you how you're using and how useful this tool is. And please keep an eye on any updates. If you want to know more about what IAPO is doing and what we are going to do specifically with the UHC Compass, you can follow our newsletter or just email us on this uhccompass@iapo.org.uk. Next slide, please. Well, this is what I just mentioned. Sorry. If you need any further information or if you want to share anything with us, this is the email that it should contact us. And now I'm very, very thrilled to invite one of the co-creators of this UHC Compass, who is also a member of the Global Patient Think Tank, Smita Sadasivan. She's also a senior advisor of the Inclusive Health Policy Disability Rights India Foundation, very engaged with CISEM as well. And she will talk about her role and as part of the Global Patient Think Tank and developer of the UHC Compass. Thank you, Smita. Over to you.
Thank you so much, Danny. And yeah, I feel it a real privilege to be part of GPTT and, to be part of arriving at this really very useful and community-oriented, tool, the Compass. And when we say Compass, it is across the globe, 360-degree, and that is how we have been visualizing it. And we had a lot of discussions when while arriving at the Compass, and the discussion started with, do we at all need it? And we put ourselves in first place on the ground and discussed a lot of issues. And what are the issues? What is the current need? And in the light of the UHC political declaration, in the light of the social participation declaration, and many other instruments at the international space, health space. And then everybody unanimously agreed that we are facing a larger issue, though there are certain advances. And while we were appreciating the advances, we wanted to have a compilation of our own experiences about the issues faced and also the advances, the best practices in certain pockets of the globe, and why not make it a comprehensive compilation where we can understand from the basics of UHC. If a community or a patient group is just starting, what would be the message for them? And to have a clear and a simple understanding about UHC, starting from there, how to network with different other like-minded communities, like-minded organizations, and how to look at different research initiatives, and very importantly, how to advocate with the government, with the policy makers. And so that is how we came up with this discussion step by step. And we also compiled a lot of best practices from the ground, and we did discuss again and again, and made a lot of changes, then did a lot of pressure testing with multiple communities across the globe, and we got a very good feedback. And with that feedback, there was a great change in the compilation, and that is how now we have arrived at this particular compass, where you can see it was not the same throughout, and we are sure that it is again going to be added, and it is a dynamic document, a live document. That's what we are aiming at, because many people have to have a lot of things to say, which will go into, and they will be happily able to add into the compilation, into the compass, is what we think. And I just want to put up a point on why should the communities or the patient groups come together for doing this. And we are people with lived experiences, but is that enough? Is that, yes, of course it is a valid reason for for being part of any discussion. And as Dumi said, we have the right to be in to have a seat in the table in any health discussions. But what more, we know our communities well, and it is not just we have the condition ourselves, but we are also practically looking at taking support, looking at managing. It is not just a treatment from a treatment or a medical angle, but we are also looking at a social angle, at an economic angle, and a real well-being angle. So when a community or a patient organization is working on all these things, and when the government is looking at majority numbers, while the communities, the patient groups are looking at individual experiences and the issues faced, and even the celebration of even tiny little successes. So this makes the life full, right? So this is the rich experience that we come up with. And of course, we are also part of clinical trials. We are observing all the researchers and the treatment protocols, the advances. So we are a comprehensive group where we are not only part of one medical aspect, whereas we are looking at holistic aspect. And this is why we need to be there in the center in all the health discussions. And like Dumi and Nicola have very well put, and Danny also have said it very well. And so what is it that we want? We would like to encourage and request, and also insist our leaders, the political leaders, to ensure that UHC, all UHC programs, policies include persons with lived experiences, communities, and the patient support groups who have a rich wealth of knowledge and experience to to contribute. And we as peer counselors, we are doing this in I would just like to give a simple example. For example, if a doctor, I am a person with multiple sclerosis, and if my neurologist is writing rituximab as the treatment protocol for a member, then he only knows that this particular drug has in Google, he in the internet, he would just browse it and see that, okay, this has some side effects and these are the advancements, these are the benefits, and doctor would say, these are the benefits that you would have, and so you have to get admitted. And doctor being very busy, having to look at many patients and many clients, he will not be able to describe the experience, the personal experience, which a member can get only from a peer counselor, from another member, that is being provided by the patient support groups. And from the beginning, what could be the allergy and what should you do if in particular scenario, and how to extend the treatment, or if you or how it can be shrunk. So these kind of minute discussions can happen only in a patient support group, which is well versed and well knowledgeable about a particular treatment protocol. So from this minute understanding, and also to looking at the holistic picture of a person, from the mental well-being, from the family well-being, the caretaker perspectives, the economic aspects, when you are looking at all the associated aspects of a person's well-being. And that is why patients organizations and the communities mean a lot and do a lot of contribution in this area, whether it is UHC or any other a need in the ground. And so we insist that the leaders take us seriously and give us a seat on the table and have our contribution meaningfully engaged, so that we all can together contribute towards a better UHC and an enhanced UHC scenario in the world. And I thank again for giving me this opportunity. Thank you, Danny. Thank you very much.
Thank you. Thank you, Smita, for all the work that you have been doing on the background for all of this to happen. Now I would like to invite Paul Mendoza. He's the president of Psoriasis Philippines and Psoriasis Asia Pacific, and he's also the secretary of IAPO. He's going to talk about his experience in doing the pressure testing of the UHC Compass, which was done with a group of patient organizations before we came up with the final version of the Compass, and how it has been helping him in his work in the Philippines. Over to you, Paul.
Thank you, Danny. Thank you for giving us the opportunity to be one of the pressure testers of this UHC Compass. When you told me about this chance and opportunity, I was very excited because here in the Philippines, we just the UHC was just approved last 2019, and this is one of the questions that I had, is how to engage the government, especially in implementing the UHC or universal healthcare. And I really like the intro of the UHC Compass Toolkit because it really emphasizes the importance of patient organizations and what we can bring onto the table. And that is the lived experiences that we have. And since we are on the grounds, we know the challenges, we know that what is lacking, and we know how difficult it is to navigate and access proper healthcare. And these are some of the things that patient organizations can bring in the table, can bring into the discussions, so that our government and policymakers and decision makers can say and see that these are the challenges, and maybe, hopefully, they can give us some solutions to these problems. And it's also, for us, when we started in our advocacy, we really had a hard time because we need to teach ourselves. We don't know where to go. We don't know who to talk with. And one of the strategies that we did is that whenever there's a health agenda or a health dialogue, whether it's related to our condition or not, we will gate crash that forum. And for us, when the Q&A, that's our favorite part, the question and answer, because that's where we can put our agenda in the table. Because here in the Philippines, there's no health package there's no health coverage, there's no health policy about psoriatic disease. And these are some of the things that we keep on pushing and asking our government to do something about it. And since we have this UHC Compass, it's really a great tool that we can use because for patient organizations who are starting to engage with UHC or even continuing their work, it's a very good guide and a framework that they can use in their advocacy work. And second is that when it comes to the module 2, it's very good to see that the toolkit teaches us how to navigate the UHC system or the healthcare system. It teaches us about where the money comes from because funding is very important and it's always been an issue when it comes to healthcare. So where does it come from? Who approves it? How does the budget go, or how is it distributed? And even which are the policymakers? It asks you the questions: which are the people that you need to look to or you need to contact to so that they can be able to help you or you can communicate with them with your issues. And here in the Philippines, we have a strong network of civil society and patient organizations together with Social Watch and Alternative Budget Initiative. We every year we review the budget allocated for health, and this is something that patient organizations can also do, not just to advocate for access to care, but also be concerned where the money comes from, where the money goes to, and how it is managed. And for the module 3, it was very exciting because this really made you think. Uh, it's an in the module 3 of the toolkit, it's an assessment for you as a patient leader and as a patient organization where you can see how are you equipped or how's your knowledge level when it comes to university healthcare. And it is very helpful. I answered this test, and to some parts we did a we are excelling and have good practices. But when it comes to data generation and data sharing, uh, we're not that expert on that, and there's really a big improvement on that. And for patient organizations, I think data generation is always an issue because I mean, in our own right, as as people who has lived experiences, we are experts because we are the ones who experiences this condition. But how do you translate these experiences to valid data? How do you translate these experiences that the government would listen to? And that is the very important role of patient organizations because these lived experiences tells the real story, the real challenges, and the real needs that we need to ask our government. And for the last part, when it comes to the module 4, it gives a lot of examples, and it's very helpful to see where you can engage as a patient organization. And here in the Philippines, we've established a lot of strong networks and alliances who focuses on healthcare. We have Healthy Philippine Alliance, the NCD Alliance national arm here in the Philippines. We focus on non-communicable diseases, and we just not discuss about the medical reasons, but also other social other impacts with the um, for the health, other social determinants of health. We also focuses on that, and I think it's also very important. And just also want to call out like what the Philippine Alliance of Patient Organizations is also doing here in the Philippines. They are seated in different departments in the Department of Health, and they give a strong voice to the patients, and they are there engaging different in different decision makings. And I think these are some of the things that we can do as patient organizations not just working in silos, but working together to give a stronger voice and to uplift everyone to the right to help. So thank you. I think that's it, Danny.
Thank you, Paul. And it's such a big relief to see that a tool that was developed throughout a year with so much work and thoughtfulness is useful for who is working on the ground. I now will rush to the panel discussion. Pam Cipriana, she needs to move to another event that is happening just after this one. She's moderating it. But before she goes, Pam, thank you so much for joining us today. But also, I would like you to talk a little bit more about the value of working with civil society and patient organizations in the UHC movement. Thank you.
Thanks, Danny, and thanks to all the other presenters that I think have given us great examples of how critical it is to engage civil society. That lived experience and bringing that personal voice to all of the discussions is irreplaceable. The other part of that is we really need those voices to talk to our parliamentarians, who are our colleagues in this effort. But we know that parliamentarians want to hear from their constituents. They want to hear from the people in their nations. And so it's really important that we hear those real world solutions, that we understand that lived experience in the stories of financial hardship. It only becomes real when we hear about them from our patients and families and across civil society. So the advocacy work is unparalleled, except coming from civil society. Professional groups can speak from a perspective of authority, if you will, or evidence base, as we've heard, is also very important. But at the same time, it is the blending of what we understand and want to promote for policy and action that is brought together by that lived experience. We also know that maintaining the momentum, again, requires all of us. And some of the most effective advocates are really our civil society organizations. I was really pleased to hear Jumi talk about the study that demonstrated, when individuals trust, they also trust their health system. And so that, again, is something that we're facing in a number of our countries now, whether it's the top leadership or the proposed policies and execution on health systems and health delivery, that if people don't trust their systems, then they will back away from even seeking the care, particularly if there's a financial hardship that they're going to experience. So more than ever, I believe it's important that all of us come together with our voices, support civil society, who also often represents those marginalized populations, to come together. And that's really another place where the UHC 2030 multi-stakeholder platform, again, I think serves our greater community. We're happy that IAPO is working with this compass now to enable and empower many, many more civil society voices to be able to bring these messages forward, because we know that action, as we've heard, has fallen behind. We desperately need to make up some progress that was lost during the pandemic toward UHC. There are monitors, there are measures, and we know we have to accelerate that work. So UHC 2030 is pleased to be a real partner in this. And again, welcome all of our CSUM colleagues and all of the work that's done across civil society, and particularly patient organizations. Thank you.
Thank you so much, Pam, and I wish you success in your webinar. I'll join you very soon.
Okay, thank you.
So Pam was talking about the importance of taking into consideration the lived experience. And Lara came here today to talk about social participation. And Lara, can you tell us if the resolution can act as a catalyst to empower civil society in advocating for increased government investment in UHC, and how, please?
Thanks so much. Well, I certainly hope so. So I think the resolution is, yes, it's a commitment. It's a commitment to member states to make this sort of their systems more participatory and their governance more participatory, and to value and respect the voices of people. And so I see it as a huge opportunity. I think it's an opportunity that needs to be seized, and by itself as a piece of paper, it's a non-binding agreement. It will not make change by itself, alone. It needs move by real change at country level through people taking ownership of this agenda, seeing their role in making it happen, and in holding their government to account for the commitments that have been made. So I think there is a huge opportunity for it as a catalyst, but I think it needs to be taken and owned by all and driven. And I think if it does, it provides a useful hook to do so. So I do think that it's very exciting, but it's not enough. It's just the beginning, really, for action to happen. And I think here there's a great opportunity for civil society and other actors, patient representative organizations, to come together and request a dialogue with the government about what is the country's specific priorities for implementation of this resolution, and how can they engage better and more meaningfully moving forwards. There will be different kinds of entry points. There may be a national planning process ahead. There may be a specific policy on being drafted. There may be a program implementation review that there's opportunities for civil society to have greater space in and greater voice. And I think it's being aware of this commitment and then proactive in initiating those opening those doors to more action, to more collaboration. And I think it would be great to see many of you, all of you, joining this network when it's established, because I think the network will be as strong as the engagement of its members. So I look to us all to work together to try and turn this paper into a movement for action.
And I completely agree with you, Laura. And this is a reflection that we've been doing a lot. So the resolution is there. Are we ready as a civil society to help implement it? And I think we are. And I would love to hear from Dumi as well, and ask, can you please share some examples of how we can do and how patient organizations, how civil society can effectively hold governments accountable for investing in UHC and make their voices heard?
Thank you for that important question, and especially even when Lara, alluded to the fact that, it's not necessarily binding. I think for us, we've got, different experiences. I think one example for, just to clarify, Botswana does not guarantee the right to health in our constitution. And I mean, even though with the previous government, because our elections were only on the 30th of October, we had a constitutional review process that would have seen that right to health be, integrated or included within our constitution. But before that, we had civil society literally litigate, for example, to ensure that prisoners did not have to pay for antiretroviral treatment. We have, models such as the country coordinating mechanisms of the Global Fund that ensure some element of participation, not to show an accountability, but at least it's in being able to design and draft proposals and ensure that whatever state programming can integrate some form of community engagement, especially because we've got a differentiated health service delivery model. And I think one other critical element is just recognizing the role of technical working groups within the context of HIV infrastructure, particularly within my region where many health systems are built off of the HIV response, and essentially recognizing that those technical working groups are essentially not only one element in capturing lived experiences, but that it can feed directly, for example, within the context of creating national strategic frameworks. A lot of work that we've also done is in essentially challenging narratives that practitioners and bureaucrats would have in terms of, for example, criminalized communities, when we're speaking about sex workers, LGBT individuals, or those who, have to turn to backdoor for some form of termination. And so I think within that context, where we recognize that there are not only challenging socioeconomic circumstances, but even where there is no legal framework, there's always at least one human rights-based approach with regards to securing accountability. And one other element that we do have, and I think that we've leveraged quite a bit, especially in instances where there were reprisals for activists, human rights defenders, or community health workers, is using human rights systems. So essentially the Universal Periodic Review, the Committee on the Elimination of Discrimination Against Women, to illuminate some of the health injustices that occur, or some of the other social determinants that impact the uptake of health seeking behavior. And I think for us, as CSEM, having produced, for example, before this compass, or contributing toward this compass, having a kit on social participation, having a toolkit on I think the Health for All toolkit that was basically giving the basics of UHC and what kind of advocacy can be engaged. And more recently, as I had mentioned, trying to figure out how can we get UHC on the ballot, and essentially having a practical example in which where we have health as one of the key electoral promises, which isn't common, and more importantly, that it can illuminate a lot of the issues, resulting in a change of government that is receptive to UHC, not only as a concept, but as a human rights-based approach to service delivery. And I think lastly, I think there's a difficulty in often bridging the gap between human rights and service delivery or sustainable development, because there's always a question around sustainability. And I think essentially recognizing patient organizations, recognizing community members or community impacted organizations essentially means that you're investing in people, the very people that need to not only be supporting, complementing, or even seeking accountability of the health system, but also the very people who are there to navigate, regardless of the circumstances, whether it's in a more repressive government setting, or it's in a setting that has limited resources, or like my country, which is a high middle income country, where there's an assumption that the state will take care of its people. But essentially having those who are most impacted in the room, challenging some of the leaders, challenging some of the policy frameworks to ensure that there's actually an ultimate test to it. And I think for me, this is ultimately reflected with our election outcome, where people exercise their democratic right and recognize that there's a need for more progressive, inclusive, and meaningful approaches in our political dispensation, and not just limited to health. Thank you.
Thank you, Dami. And also, I love the fact that you brought equity to this discussion. And this is a big part of the resolution as well, because we want to make sure that we have different voices in this discussion. It's not only the loudest one. And the fact that you also highlighted many ways that we can make our voice heard in elections and how to hold candidates accountable. But also, I'd love to hear from Paul and Smita about if they have any recommendations on how the patient organizations on the ground can start also making their voice heard and engage in the UHC agenda, of course, based on the fact that they were part of the development of the Compass or as a pressure tester. Maybe Smita can start, and then Paul.
Yeah. So I would, yes, I definitely have a few recommendations which everybody will have in their mind, I suppose. One is budget, increasing the budget, and a budget of UHC for every country, and the leaders giving importance to UHC when there are multiple areas that they are giving priority. Let us make health and UHC the priority, and it should to be ensured as inclusive UHC. And inclusive, when I say, it should not be tokenistic, but it should be meaningful participation of the communities. So if this can be arranged, and the third and most important thing is to focus on primary health care. So to have medication or health system, healthcare services at the community level in collaboration with the communities working on the ground. If this can be done, then there will be a great collaboration with the resources from the government, and also from the expertise from other experts, the academia and researchers, and the ground realities and the support systems evolved, and community work done by the communities at the ground. So if these three can collaborate together, then that will be a really fantastic approach, which the leaders should consider and give a seat to us on the table. Thank you.
Thank you. Paul?
Yeah, for the UHC Compass, for patient leaders and patient organizations who are here with us tonight, for me, it's really a very helpful tool that you can use when it comes to UHC, whether you're a newbie or you're just starting, or or you're an expert already, you'll still learn a lot from it. Um, and for you, we don't need to start big. We can always start small. Like for us, in our community levels, we help build patient communities, support groups in different locations, and we empower them to engage with their government, with their mayors, with their governors, with their health officers. And one of the success stories that we had is that we had three chapters who were certified as a part of the civil society council in that city. And I think with the UHC tool, it is very helpful for those small community-led, small patient groups that can start in engaging with UHC. They can start the effective way is for them to start where they are located. I think that the toolkit also helps us to also give some guide how to start or to put together these patients or these people and to get their live experiences, because this is the most effective uh, things that we can give to our government so that our government will listen, and that it is also effective that this will give a face to the condition, to the patients. And um, and for and of course it's always, for us leaders, it's always focus on capacitating ourselves. We need to learn and learn, because it everything changes every year. There's a new thing that's coming up. So having capacity building, it's very important. And for us in Psoriasis Philippines, we are already planning to include the UHC Compass in our SOR Coach University so that we can capacitate our leaders to effectively engage in their local communities. Thank
Wow,
you.
this is great. Thank you, Paul. And if Antonia can share the next slide, I would love to remind you all that the UHC Compass is live. Please download it. Please use it. Share with us how you're using, if it's working, if it's useful. If it's not, tell us. We are there to continue developing and improving it. And I'll leave this slide there so you can download it. And also, I would like to share a huge thank you for all those speakers today. I know this is a very busy week for our global health community with UHC Day, and you are also engaged with everything related to UHC, but I really wanted us to link all those dots today and be here and discuss UHC social participation and the UHC Compass, because I think we, as I said before a few times, I think we are in a very good moment and we have to seize this opportunity and keep working together. It's not only IAPO, it's not only the WHO member states. This is a joint effort that we need to put to collaborate and continue working together. A big thank you as well to everyone who works on the UHC Compass to turn this into this tool, the Global Patient Think Tank, but also the team behind the development of the tool, and Nicola. Thank you everyone for joining. It was a big pleasure to have you here, and I look forward to our next meeting, webinar next year. Keep uh, following us on social media or our newsletter, because we will continue to invite you to more discussions like this. Thank you so much for coming. Bye-bye.
Bye-bye. Thank you.
Thank
Very
you.
much.
Bye.
Thank you. Bye-bye.